We're now being joined by Dr. Fazil Khan, who is trained as a physician and an attorney and is a professor of health law and policy at UGA's School of Law. Fazil, I'd like to first ask you to summarize the November election. Just in general, what happened in the election?
In short, the Republicans did very well in the election and gained a lot of seats in both the House and the Senate and in the governor's races. And
so I imagine this is potentially huge impacts on healthcare reform legislation. So what are your thoughts about that?
Sure. You know, one of the platforms of the Republicans was that they wanted to repeal the healthcare reform. And so given the fact that, you know, they won the House, won some seats in the Senate, this might be seen as, say, a mandate to kind of repeal healthcare reform. But I'm not so sure that's exactly what that means.
Okay, so if it's not repeal, what are some of the other options that might happen now that there's been this change in leadership?
If you look at Speaker-to-be John Boehner, he said he wants to repeal healthcare reform or defund it or reform it, and they're going to try all three different approaches.
I've heard the same, but I mean, is there a real possibility of repeal here?
I don't think repeal is likely because you look at the numbers, Republicans do have a majority in the House, so they can introduce this bill in the House and pass it there. But the Democrats still hold a majority in the Senate, so they can filibuster this bill, and President Obama can veto it. And the Republicans don't have the numbers to overcome that veto. So practically speaking, I don't think repeal is likely.
And so the other two options, defund and reform, let's talk about defund first. What can they do in that area?
Even for defunding, they'd still have to kind of pass a bill saying we're going to defund health care. And so I think the same analysis applies to repeal. But they can hold up, say, funding for certain committees, not print out certain materials which are necessary to implement this health care reform bill. So they can kind of gunk up the works and kind of slow the implementation and use that as a lever to get some of the reform or tweaking that they want.
Well, let's talk about the tweaking or the reform pieces. In your opinion, what in the legislation will people want to reform right away?
I think the one thing that is most likely is this kind of IRS reporting requirement for small businesses, these so-called 1099 forms, which actually started in the Bush administration, and they just added to this bill. It really doesn't have anything directly to do with the health care reform bill, and you see a lot of Democrats, including President Obama, saying they're willing to compromise on that. So I think that's likely to drop out of the bill.
And what are some of the pieces of the legislation that both Democrats and Republicans will be able to get behind?
Yeah, I think some of the pieces of the legislation already went into effect in 2010, such as banning denials of coverage based on pre-existing conditions, the practice of rescission, ending coverage once you already have it, and limits on out-of-pocket expenses. Those are popular on a bipartisan basis. I think those will stay in.
And I imagine that the governor's races that happened in November will also have an impact. Can you summarize what happened there and your thoughts about what might happen with the legislation now?
Sure. So the Republicans also took control of a lot of the governor's houses. And states typically regulate insurance, so they can appoint insurance commissioners. In Georgia, it's different. We elect our commissioners directly. But what they can do is they're charged under the health care reform bill to implement and enforce on the provisions, such as setting up the state exchanges and also regulating insurance companies to make sure they don't engage in these practices, which are now illegal. And so to the extent they oppose health care reform, they can say we're not going to enforce federal laws, and they can join this lawsuit, which is currently going on, that 20 state attorney generals have joined, challenging the constitutionality of the individual mandate and the expansion of Medicaid.
You know, I've been hearing about this lawsuit, but where is that lawsuit in process, and what, in your opinion, will happen in the end with the lawsuit?
Yeah, there's three major lawsuits. One in Michigan by private parties, which the judge dismissed, saying that they didn't have standing and that they said it's constitutional as it applies to them. There's another one in Virginia, and the big one's in Florida, where 20 states attorney generals have joined that lawsuit. It's already gone past initial proceedings, where a lot of commentators thought it would be dismissed in early stages. And so it's going on to what's called a summary judgment motion, where the judge will hear in mid-December kind of the merits of the case and see whether or not the opponents have made credible arguments that it is in fact unconstitutional, these two provisions.
Well, whether you're for or against this legislation, this is a really exciting time to be watching it from a legal standpoint, I can imagine.
Oh, absolutely. There's a lot going on here.
Now that we've heard your viewpoint on the legislation, being an attorney, I'm very interested in knowing how you feel about the legislation in general as a physician.
I think improving access is important in terms of outcomes for individuals. I think you talked earlier that you know, if you don't have insurance, that's actually a negative predictor on how healthy you're going to be. So that's important. But I think it gets lost in a lot of discussions, all these other parts of the reform package, such as investing in information technology infrastructure, focus on preventive care, primary care, and all these other things are kind of lost in discussion. I think will actually be very beneficial in kind of restructuring, integrating a lot of the moving pieces in healthcare that before haven't been coordinated. So I think those are really important pieces.
Thank you very much, Dr. Khan.
Thank you.
And now we'll be asking some of our students what they like about the legislation that was passed earlier this year and what they don't like about the legislation.
Yeah, I think a lot of the work as far as money for preventative medicine or money for comparative effectiveness, which can help to figure out which treatments or which strategies are the best strategies instead of using these age-old strategies we've been using that simply don't work simply because that's just the way it's always been. I think things like that are important, but I'm afraid those are going to be some of the first things to go.
I also am very in favor of the fact that the copay for preventative screenings has been eliminated, and I feel like that will make great strides in improving the health of Americans because they'll take advantage of the screenings where they previously would not have had the financial resources to do so.
I also like that there's pre-existing condition clauses are gone out of insurance reforms because I've had a background with medical history problems, and so I'm very excited that that is not going to be an issue for me in the future.
I definitely like the expanded coverage through Medicaid and also the setup of state health exchanges. It's just going to make it easier for people to find insurance that's affordable.
And is there anything in the legislation that you really don't like, or is there something that you wish was included in the legislation?
I think that it's a little naive to think that it's going to really cover everyone straight off and that it is still going to, healthcare and health insurance is going to be affordable for everyone. There are still going to be people who really cannot afford whatever coverage is provided out there. I also think there's room for more cost-cutting measures, that is kind of a missed target there, that there's not enough to just keep pouring money into it instead of rearranging the great deal of money that's already in the system.
I think it makes the system a lot more complex, and it doesn't necessarily fix the underlying problems, that it's not a complete and true system. And so it doesn't provide any kind of systematic framework to make it a more channeled, flowing system.
I really wish that there had been more focus on infrastructure, improving access to hospital or physicians and just care in general, more free clinics and things like that.
I don't know that I would do away with anything, but I do not think that they've appropriately considered how to finance it, and I feel that they will struggle to finance this in the future, and they've placed taxes on citizens or different services that they do not know how much money will generate from these taxes, and so you can't guarantee that that will provide enough income or revenue to finance this program.
And I'm going to ask you a similar question that I asked some of the students earlier, which is, in this legislation, what are you really passionate about? What is exciting to you that's there?
What I'm passionate about is kind of commitment to expand care to people who don't have it right now. And I think that's an important statement that, you know, healthcare is part of our social contract, the same way national security is, same way economic security is. And I think that's an important political statement for our country.
Okay, but what's in the legislation that you wish wasn't there?
Well, there's not enough cost control in this legislation. I'm really concerned about that. You don't have a public option there. Your state-based exchange is not a national insurance exchange. Not enough bargaining power to really kind of, you know, cut payments to, say, drug companies, medical device companies, and doctors. I think you need more kind of cost-limiting structures within this reform package.
You know, as a result of this episode, Phaedra, I feel like I have a much better understanding of what's really going on in this healthcare legislation.
And we have no idea what's going to happen in the future, so it will be really important for us to watch this legislation over the next couple of years.
Of course, there are immediate effects, too. For instance, on my way over here to film this episode, I was able to add my 22-year-old daughter back onto our healthcare plan. I had to drop her before when she graduated from college, and now, as a direct result of this legislation, she's covered for another 4 years. These things are affecting people right now.
Yeah, well, that's a great example of how the legislation can help families immediately. And another way that legislation is improving population-level health is the elimination of that out-of-pocket expenditures that people will have to pay for preventive services like mammography screening and hypertension. That's really important for improving our health in the communities.
Well, these are definitely exciting times in health policy and management, and we'll have to keep a close eye on this and see how it all comes out.
In our next episode, we'll be talking about another very important issue in policy, and that is global health. And we'll be talking to some of our experts and faculty members in the Center for Global Health here in the University of Georgia's College of Public Health.
So check your TV listings for the next episode of PHI, Public Health Impact.